Hello everyone. Let us start today our revision series of repertory. We will revise today repertory of Materia Medica by Kent Repertory. Okay. So Kent sir was born on 31st March 1849 in Woodhull. He died from bright disease on 6th June 1916, whereas Dr. Henneman died due to bronchial catarrh. Bonninghausen died due to apoplexy and Hearing died due to paralysis of heart. In Kent repertory, you will see that Kent started working with Lee and he completed Mind, Head and Vertigo chapters with the Lee. But while compiling it, Dr. Lee get blind. So further Dr. Kent have to do all his work. If you talk about the logic, our Kent repertory is based on deductive logic, that is from general to particular. If we talk about topography, we have three topography: bold, italic, Roman, that is BIR. Okay. Gradation, on what is the criteria of gradation? It is proving, reproving and verification. As we know that Kent have given prime importance to mental symptoms. Moon phase is not mentioned in Kent repertory. Specific hour is not mentioned in BBCR and specific time is not mentioned in BTPB. Okay. Now let us look at the editions of Kent repertory. First edition of Kent repertory was published on year 1897, published by Kent himself at Philadelphia. Second edition was published in 1908 by Kent at Lancaster. Third edition was the first posthumous edition in 1824, published by Ethard at Chicago, assisted by Gladwin and Pugh. थर्ड एडिशन चोरी हो गई थी बट केसी मित्तल के पास मिली थी. फोर्थ एडिशन 1835 में पब्लिश हुई थी, पब्लिश विद द हेल्प ऑफ ग्लैडविन, क्लारा लुइस केंट एंड पेरियर श्मिट एट शिकागो. क्लारा लुइस केंट जो थी वो केंट सर की वाइफ थी. फिफ्थ एडिशन 1845 में पब्लिश हुआ था, पब्लिश्ड विद द हेल्प ऑफ ग्लैडविन, क्लारा लुइस केंट, पेरियर श्मिट एट शिकागो. दिस एडिशन वॉज अ pay to tribute to Clara Lewis Kent. That is, it was published after the death of Clara Lewis Kent. Sixth edition was an American edition in 1957. Sixth edition, published as a first edition of India, was in 1961. Indian edition, it was published by Hepco. Now let us study about modified editions of Kent repertory. You can see in 1874, final general repertory. It was written by Diwan Harishchand and Pereira Schmidt. It had 39 chapters. Smell and voice are independent chapters. In 1987, Repertorium Generale. Kent Repertorium Generale was written by Kunzli. In German language, 27 chapters and 689 medicine. What were the sources of Kent repertory? It is very important. Kent used Lippe repertory. For many years, he adopted Lippe repertory plan in his repertory. Lippe repertory has 34 chapters, but Kent made 37 chapters in his repertory. The skeleton of the plan of Kent repertory mostly based on the heading of drugs of encyclopedia. Means the chapter he have taken somewhere idea from Lippe's repertory, and the skeleton of all the repertory it was taken from drugs of encyclopedia. The main source of Kent repertory were two repertory, mainly Gentry repertory and Lippe repertory. Lee have completed Mind, Head and Vertigo. Later Kent used these chapters in his repertory. What were the important source? Allen Encyclopedia, Allen Symptoms Register, Milton Uterine Therapeutics, Jar Symptom Codex, BTPB, Bigler's Diary and Lippe's Repertory. Now we talk about eliminating rubric. This is a basic repertorization through Kent's repertory. Means Kent repertorization is somewhere based on eliminating rubric. This method was first introduced by Emil Tyler and Sir John Weir. Dr. Gibson Millen gave hot and cold remedies, relationship of remedies and side of the body, Attached to Kent repertory was written by Gibson Miller. Relationship of remedy and sides of body. Okay. If we talk about criteria for gradation of medicine, criteria first grade was given majority of provers. Uh, it was confirmed in reproving and also verified upon sick. Second grade was given to few provers. It was confirmed by reproving but occasionally verified on sick. Third grade was occasionally seen in proving, not confirmed in reproving, and it was verified by curing sick only. Okay. What are the key statistics you will found in Kent repertory? It is very important. As a point of our Aiapget exam, total number of medicine in our Kent repertory is 648. Total number of pages is 1423. Total number of notes is 15. Total number of chapter is 37. Biggest chapter is your extremities, containing 268 rubrics page wise. Smallest chapter page wise you will have prostate. Maximum number of rubrics in chapter is in mind. Minimum number of rubric in chapter is of hearing. There are only 4 rubrics. Largest rubric you will find in chapter cough and medicine would be mido. Total number of rubrics is 69,360. Rubric in chapter generalities is 246. Rubric in chapter extremities is 268. There is over particularized chapter is extremities and over generalized chapter is your mind. First rubric of chapter mind is your abundant, very important, very frequently asked in vivas. Last rubric of a chapter of mind is wrong everything seems. If we talk about first rubric in BBCR, you will see absence of lost in thoughts. In Boric you will find awkward, and in BTPB you will find absence of mind. It is very important. In BTPB you will find mistrust and amativeness, जो कि केंट में नहीं मिलेगा आपको. Okay. Total number of medicine as we have discussed is 648. 6 medicine were used with the synonym names. Okay. These are sometimes asked, so you just remember their names. Then so if we minus 648 minus 642 medicines. If we talk about arrangement of rubrics are arranged in alphabetical manner. Medicine under each rubric is also arranged in alphabetical manner. But in cough, expectoration and generalities, it was not followed. Sub-rubric follow STMEL arrangement. It is not followed in generalities and it was given by Julian Miner. What is STMELE? STMEL is site, time, modality, extension and localities. Okay. If we talk about chapters given in the as of the arrangements, first is mind, vertigo, head, eye, vision, ear, hear, nose, face, mouth, throat, external throat, stomach, abdomen, rectum, stool, urinary organ. In this it is bladder, kidney, prostate, urethra, urine. Genitalia male, genitalia female, larynx and trachea, respiration, cough, expectoration, chest, back, extremities, sleep, chill, fever, perspiration, skin and generalities. Now let us just have a go through of important rubrics covered in a chapter. In vertigo, you will find syncope, reeling, fall tendency to, intoxicated as if object seems too far off, shaving after, wall of house seems to be falling in on her. In BTPP, vertigo is placed in intellect chapter. It is very important and question also asked. In head, we have different rubrics as of concussion of brain, dandruff, encephalitis, falling down, inflammation of meninges, hair falling, In BTPP, you will find hair falling in sensation and complaints, hydrocephalus, lice, sunstroke, wall of house seems to be falling in on her, baldness and vacant filling. In eye, you will find astigmatism, emesis, arcus senilis, cataract, chalazel, falling of hair from brows and eyelashes, exophthalmos, eye gums, glaucoma, hydrodula, that is ties, onyx, photophobia, panas, paralysis of optic nerve or emesis. In BTBB or BBCR, paralysis of optic nerve is given in chapter vision, but in Kent it is given in eye, staring and strabismus. In vision, you will get it from cipher muscae voluntaris, that is there would be somewhat black spots. Then sparks and flickering, we have medical term as scintillations, scotoma and illusions. Here we have noise, reperfusion and statoma, that is tumor. In hearing, we have only 4 rubric, that is acute, distance, illusion, impaired. Nose, we have catarrh, coryza, epistaxis, hay fever, uzina, polypus, smell, sneezing, shuffle. Face, we have symptom related to the following parts are mentioned as of cheek, chin, lip, jaw, parotid gland. In BTPP, it is found in ear, submaxillary, sublingual and salivary gland, and zygoma. Beard, falling of whiskers, greasy face, labia nasalis. Triasmus, hypocritic, rhesus sarcoidosis, pimples and comedons, expression, mumps, shaving aggravates complaints, sinus, noil, meat, tanger on nose. Under rubric cancer. In mouth, you will found symptoms related to gums, tongue and palate. Aphthe, canker oris, fistula gums, euplis, odor breath, noma, paralysis of tongue, ranula, saliva, speech, stammering, taste. In BTPP and BPCR, taste is given as a separate chapter. Trembling of tongue, impaired imprint of teeth on tongue, that is intended tongue. On teeth, you will have caries, catering, dentition difficult, dwarf teeth, grinding, swords. In throat, you will find symptoms related to esophagus, pharynx, tonsils and uvula. Okay, so diphtheria, globus hystericus, tonsillitis, swallowing difficult, phosis and choking. External throat, you will have symptoms of cervical gland, side, throat pit, thyroid gland and anterior neck. Posterior part of neck is given under chapter back. Goiter, sternomastoid, carotid, stiffness of side and torticollis. Torticollis is often asked, so it is important. Stomach में है appetite, death sensation, desire, aversion. Desire and aversion you will found in stomach. But food disagree is given in chapter generalities. Distension, emptiness, eructations, water brash, retching, gagging, heartburn, hiccup, loathing of food, nausea, regurgitation, satiety, thirst, thirstless and vomiting. Abdomen, you will have symptoms related to hypochondria, hypogastrium, ileocecal region, iliac region, ileum crust, inguinal region, liver, side, spleen, umbilicus. All the things which are in your abdomen, liver, spleen, then your 9 quadrants, everything whichever come here will become over here. Okay. A live sensation of something, borgoemy, diarrhea sensation as if come on, dropsiasitis, bubo, cirrhosis of liver, flatulency, hoary palpitations, inguinal region and inguinal gland. In BTPB, inguinal gland is given in external abdomen and inguinal ring is given in internal abdomen. In BBCR, it is given in inguinal and pubic region. Distension is mentioned as metrorism. Distension is also mentioned as tymphanitis and tabes as of tuberculosis. Tabes mesenterica, that is TB of intestines. Then appendicitis, typhlitis, intersusception and hernia. In BTPB, hernia is given in internal abdomen, whereas in BBCR, umbilical hernia is given in external abdomen. Okay, in BTPB, hernia is given in internal abdomen, and BBCR, umbilical hernia is given in external abdomen, and inguinal hernia is given in inguinal region. Okay, and rumbling. All of this is here in abdomen. Then we come to rubric rectum. It have cholera, constipation alternating with diarrhea, dysentery, flatulence, fissure, fistula, hemorrhoids, worms, perineum, nates between prolapse and tenesmus. In stool, we have quality and quantity of stool is discussed over here. As a bloody stool or dog-like or sheep dung-like, folliculi, frequent, frog span, linentrica, scanty, mucus, odor, hard, soft. Then we have urinary organ. In urinary organ, we have chapter rubrics related to bladder, kidney, prostate, urethra, urine. In BTPB and BBCR, they are arranged anatomically, but in this CAT repertory it is arranged alphabetically, so it is important. Okay. In bladder, you will have rubric like calculi, nocturna incontinence, retention of urine, tumor, urging to urinate, urination dribbling, urination dysuria, urination feeble stream, urination forked stream, urination interrupted, urination involuntary, worm sensation as if. In kidney, you will have Addison disease, suppression of urine and ureters. Prostate gland, emission of prostatic fluid, enlargement, induration and fenestrating sensation. There is only single medicine, cyclamen. Quivering nervous, you have only medicine, Formica rufa. In urethra, you have cordy, pain before, during and after urination, stricture, and different parts of urethra are discussed over here, as if anterior part, fossa navicularis, glandular portion and meatus. In urine, you have cast, diabetes, sediments, quantity and quality of urine as of albuminous, scanty, milky, if specific gravity is increased, if have whey-like or yeast-like. In male genitalia, we have symptoms discussed related to penis, scrotum, spermatic cord, testis, meningitis, pelanuria, emphyocele, elephantiasis scrotum, nocturnal emission, sexual passion, diminished erection, hydrocele, impotency, masturbation, phimosis, sacrocele, smega, varicocele. Genitalia female, we have symptoms mentioned over here of ovaries, uterus and vagina, and also symptom related to labor pain, after pain, parturition and pregnancy is also mentioned in genitalia female. Abortion, desire diminished, displacement of uterus, leukorrhea, lochia, menopause, menses, metrorrhagia, nymphomania, physomestra, prolapse uterus, placenta retained, sterility, subinvolution, vaginismus. In larynx and trachea, we have symptoms related to part that's of larynx, throat pit and trachea. We have laryngismus, triodulus, edema, phthisis larynx, croup, voice and voice hoarseness. In respiration, we have asphyxia, asthmatic, rattling, sighing, snoring, sobbing, stertorous, and stridulous. Cough, we have barking cough, expectoration, ambulate, measles during. Sciatica alternating in summer. Whooping cough. Largest rubric in repertory. Uh, this largest rubric in medicine given is Mido. Expectoration, it is calcareous, tubercles, or phosphorescent. In chest, we have rubrics mentioned related to axilla, mammae, nipple, pleura, lungs, heart, pericardium, clavicle, sternum, axillary gland, costal cartilage, aorta, and diaphragm. Actylasis, galactoria, milk, murmur, angina pectoris, emphysema, phthisis pulmonaris, inflammation bronchial tubules, inflammation pleura, inflammation lungs, pulsation, sternocardia, and trembling. In back, you have uh, symptoms related to cervical, dorsal, lumbar, sacrum, coccyx, scapula, shoulder belt, vein, and spine. You have spinal bifida, concussion of spine, curvature of spine, amphothonus, injuries of spine, obstruenus, and inflammation of membrane and spinal meningitis. In extremities, you have symptoms related to shoulder, upper limb, lower limb, including all joints of limbs and nails. In extremities, arthritic nodocytes, awkwardness, bursa, bunion, chilblains, chorea, conversion, corns, dislocation, complaints of nails as of phelon, panatrium, pernocchia, hangnails, whitlow, ganglion, gout, gizzes, heartbeat palpitations, that is goose flesh, milk leg, sciatica, restlessness, subsaltus, varicose. In sleep, we have comatose, dream, position, sleeplessness, and yawning. In chill, we have quaternion, tertian, side, one side, single part. In fever, we have measles. As of rubric is exanthemic fever, measles, also found in skin eruption measles. Scarlatina. Then we have different fever are given as of catarrhal fever, cerebrospinal fever, continuous fever, typhus or typhoid, gastric fever, hectic fever, paroxysmal fever, purpureal fever, septic fever, yellow fever, or zygotic fever. But hay fever is given in nose. It is important. Perspiration, different type of perspiration is given as of acrid, bloody, clampy, coldy, colcuative, hot, oily, odor, different varieties, scanty, side one side, single part. Staining the linen. Suppressed complaints from face of a whole body. Skin, we have anesthesis, cicatrices, decubitus, ecchymosis, goose flesh, gangrene, heat without fever, intrigo, jaundice, lousiness, navy, purpura hemorrhagica, ulcer, warts. In comedons is found also in face eruption. There are different type of eruption as of boils, that is skin eruption boils. Measles, skin eruption measles. Leprosy, skin eruption leprosy. Herpetic zoster, skin eruption herpetic. Pemphigus, skin eruption pemphigus. Then we have psoriasis, that is skin eruption psoriasis. Rupea, skin eruption rupea. Scarlatina, skin eruption scarlatina. Scabies, skin eruption scabies. Chickenpox, smallpox, urticaria. You will all found in skin eruption. Then our last is generalities. So different type of clinical condition as of abscess, anemia, apoplexy, cancerous affection, conversion, dropsy, leukemia, marasmus, paralysis, polypus, scurvy, septicemia, psychosis, syphilis, thrombosis is given in generalities. And weather, different type of weather as of air, seashore, autumn aggravate in, cloudy weather aggravate, clear weather aggravate, cold air aggravate, cold dry weather aggravate, cold wet weather aggravate, dry weather aggravate, foggy weather aggravate, spring in, snow air aggravate. Storm approach of summer in, sun from exposure to, warm wet weather, windy cold, windy warm south, windy south, stormy weather winter in, and also ailments from is given in this chapter. Arsenic poisoning, China, gonorrhea suppressed, intoxication after iron abuse of, loss of fluid, measles after, mercury abuse of, onanism from, perspiration suppression from, quinine abuse in, sexual access from, silesia from abuse, scarlet fever after, sulfur abuse of, vaccination after. Other rubric found here are atrophy gland, chlorosis, chorea, tendency to take cold, cyanosis, dwarfiness, emaciation, faintness. Food aggravation and amelioration is also given here. Desire of food and drink is given in chapter stomach, whereas in synthesis repertory, desire and aversion of food is given in general chapter. But in Kent repertory, we can find it in desire and aversion to food given particularly under stomach. Foreign body sensation as if hemorrhage, formication, induration, inflammation, injuries, lie down inclination to, nursing children, magnetism ameliorate, metastasis. Moonlight aggravate, narcotic aggravate, obesity, old age, premature, paralysis agitans, Parkinson's disease, pulse, reaction lack of, shock from injury, slow repair, varicose vein, worm under skin sensation, wound, wine, hot patient is given as hot sensation of, chilly patient is given as heat, vital lack of. Then we have some main rubrics which should we have no. Refuse to eat is given in mind as rubric eat refuse to take medicine, mind refuse to take medicine, aversion to riding carriage, mind riding in carriage averse to, patient want to sit, mind sit inclination to, patient want to lie down, generalities lie down inclination to, patient never want to speak the truth, mind lie never speak the truth, bold and confident, mind presumptuous, closing I am red, mind closing I am red, alcoholism mania I put out, it is important, asked. Slow or hasty speech, mind. Careless is mind heedless. Person exhibiting excessive enthusiasm and intense, uncritical devotion towards some controversial matter is fanaticism. Fearless of taking extreme risk is audacity. One who takes things non-seriously is frivolous. Facial expression expressive of suffering, grimaces. Interference in other work is meddlesome. Let us also just take a look from different texts. Some point if have been left. Kent repertory full name was repertory of homeopathic materia medica. हमने पढ़ लिया था. J.T. Kent सर का born हुआ था 31st March and his death was 1849 and death हुआ था 6 June 1916. First edition 1897. Philadelphia India first edition 1961. पेरियर स्मिथ ने हेल्प किया था 3rd, 4th और 5th एडिशन में. डॉक्टर किम्मेल, थर्स्टन एंड ग्लाइकर हेल्प केंट थ्रू गेट इनफ सब्सक्राइबर. 648 मेडिसिन थी बट एक्चुअली 6 सिनोनियम थी तो फिर 642 मेडिसिन भी थी. दीज वर 6 सिनोनियम मेडिसिन. ग्रेडेशन की बात कर ली थी हमने BIR एंड दिस आर criteria is based on proving, reproving and clinically verified. In Kent repertory we have 3 parts, mainly prefix, repertory part and suffix. In repertory we have use of repertory by Kent, how to study repertory by Kent, how to use repertory by Kent, repertorization by M.L. Tyler and John Weir, hot and cold remedies by Gibson Miller and few cases. In repertory part we have prefix part, different edition, list of remedies with abbreviation, text proper and word index. In suffix part we have bodies Sites of Body and Drug Affinities by Boning Hassan, Relationship of Remedy by Gibson Miller. Largest chapter is Extremities. Hearing is the smallest chapter. Prostate is the smallest rubric, chapter wise, page wise. It is 21 rubric. Mind have the maximum number of rubrics. Gladwin copied Thirst from Kent and from other repertories. Kent Philosophy was published in 1900. Kent Materia Medica 1905 में आई थी एंड कैंट बिकेम प्रोफेसर इन 1883. याद रखना है हमें, पहले फिलोसफी आई थी कैंट सर की, फिर आई थी मटेरिया मेडिका. सबसे पहले सर की आई थी रेपर्टरी, कैंट रेपर्टरी, फिर उसके बाद आई थी फिलोसफी, फिर उसके बाद आई थी मटेरिया मेडिका. RPM करके याद रख सकते हो, रेपर्टरी, फिलोसफी, मटेरिया मेडिका. केंट सर जो ग्रेजुएट हुए थे वो मेडिसिन यूनिवर्सिटी से ग्रेजुएट हुए थे. उन्हें लिपि के साथ वर्क किया था, हमने पढ़ चुके हैं. 6 वॉल्यूम में आए थे. गेंट्री एंड कंकॉर्डेंस, ये भी हो चुका है. डॉक्टर बार्थल एंड विंकलिंकर viewed Kent as most appropriate and completely reliable. STME जो है वो जूलिया मिनेवरा ग्रीन लेके आई थी. Kent Repertorium generally is by Jost Consley, 27 chapters. ये वाला पार्ट हम दूसरे में कर लेंगे केंट रेपर्टरी का. ओके, थैंक यू.